So recently I was talking to a lady who told me she went to her doctor and the doctor said, you have visceral fat and it's dangerous and you need to go on a diet. But he didn't really tell her exactly what diet to go on. So let's just talk about the dangerous fat, okay? It's called visceral fat. But let me just show you the mechanism of how you get there in the first place. So you have this high insulin, okay? Insulin is a fat-making hormone. It's a fat-storing hormone. In the presence of just a little bit of insulin, you will not burn fat because it prevents the burning and the utilization of fat. And what triggers this is dietary sugars and carbs, frequent eating, omega-6 fatty acids like corn oil, soy oil, GMO, stress, and there's a whole list of other things as well, but these are really important things to know about. 65% of the population is pre-diabetic. So they may not have high sugars yet, like excessively high, but their sugars are starting going higher. But I think even a greater percentage of people have a higher amounts of insulin because this is what comes right before the pre-diabetes. Okay, so you have high insulin, and you can have a whole chain of effects from belly fat to high cholesterol to high blood pressure to inflammation to brain fog. So your body then has to protect itself from the damaging effects of high insulin and high sugar. So it starts to develop a condition called insulin resistance. This is basically a protective mechanism to block the absorption of insulin. Okay, to kind of limit the amount of sugar and insulin going in the cells because it's harmful. So if a person continues to consume too many carbs too frequently, you're going to overload the blood and it has to go somewhere. So that sugar is then converted to visceral fat. So this is fat around the organs, inside the abdomen, because it has no place to go. So it's kind of a spillover fat. The liver is already, fatty, so it has to spill off into the abdominal cavity. So you have all this visceral fat. So this is really a storage facility of the excess energy that's coming in the body right here that your body can't do anything with. So it dumps it into some storage, around the organs. So it's trying to protect you. And it is true that visceral fat then gives off certain things that create more inflammation. That's true. This is why they tell you obesity is a risk factor for diabetes, heart disease, high blood pressure, metabolic syndrome, cancer, because visceral fat gives off inflammatory compounds, which then worsen insulin resistance, which then causes more visceral fat. So it's a vicious cycle. So this whole emphasis is on obesity and the dangerous fat, getting rid of it. But what about this thing right here? Very little attention on this. It's all about go on a diet, do more exercise, eat less calories, etc., etc. So I just wanted to show you very simply what's really happening, what the body's trying to do. So the question is fat really dangerous? Well, not nearly as dangerous as this right here. Thanks for watching. Hey, if you're liking this content, please subscribe now, and I will actually keep you updated on future videos.